Hello, I'm Dr. Magda El-Diwani, Associate Professor at the University of Texas Dental Branch in Houston. In this video, you will see how to make accurate diagnostic models from an alginate impression. Study models, also called study casts, are a replica of a patient's hard and soft oral tissues. These models are used for diagnosis, treatment planning, or fabrication of home bleaching trays. They are made from dental stone, which is poured into an alginate impression of the patient's mouth. This video will demonstrate the technique of pouring dental stone in an alginate impression and trimming the resulting model. The materials needed are a rubber bowl, a spatula, a lab knife, a pre-measured package of dental stone, a water measure, a base former or boxing wax, and a vibrator. Stone should be poured in the impression within 10 to 15 minutes after removing the impression from the patient's mouth. Before beginning, rinse all disinfectant from the impression. Then remove all excess water by shaking the impression. Follow the manufacturer's instructions for powder and liquid measure. The correct water-powder ratio is critical for proper expansion and strength of the gypsum material. First, measure water into the mixing bowl. Add powder slowly to the water over a period of 30 seconds. This technique allows air trapped in the powder to escape. Hand mix until all the powder is incorporated, and then mix vigorously for at least 30 more seconds. A vacuum mixer can be used if available. While mixing, scrape the sides of the bowl periodically with the spatula to ensure that water wets all the powder. Vibrate the mixed gypsum for 10 to 15 seconds on the vibrator to force bubbles to the top of the mix. This technique also improves the flow of the gypsum. To ensure a smooth surface in the tongue area of the model, make a tongue spacer out of a wet paper towel. Then adapt it to the tongue space area, being careful not to disturb the impression. Begin pouring while vibrating. The gypsum must be carefully vibrated into the impression in small increments, starting from the posterior end of the impression. As you vibrate the material, allow the mix to flow across the impression. Avoid incorporation of air pockets. Increments are added until the teeth and soft tissue areas are filled with stone. This demonstration will show a two-step pour technique, which provide the best results. After the anatomic portions are covered with the first pour, the top surface is covered with retention blebs. Remove the model from the vibrator and use the handle to suspend the model. First, measure water into the mixing bowl. Add powder slowly to the water. Hand mix until all the powder is incorporated, and then mix vigorously for at least 30 more seconds. While mixing, scrape the sides of the bowl periodically with the spatula. Vibrate the mixed gypsum for 10 to 15 seconds. As you vibrate the material, allow the mix to flow across the impression. Avoid incorporation of air pockets. Increments are added until the teeth and soft tissue areas are filled with stone. After the anatomic portions are covered with the first pour, The top surface is covered with retention blebs. And use the handle to suspend the model. After the initial set, invert the impression on a pile of freshly mixed stone that has been placed in a base former. Make sure the impression is parallel to the base former. Boxing wax may also be used to contain the base material. You can tell that the final set has begun when the model becomes warm. Complete hardening of the model requires 45 to 60 minutes. Separate the model from the impression tray. Disinfect the model if necessary. Inspect the model for accuracy and the absence of voids. In order to trim the models, you will need a model trimmer and a lab knife. Soak the models in water for 5 to 10 minutes in order to facilitate trimming. A dry model may produce excessive dust during the trimming process. The first step is to place the models in occlusion and remove any artifacts with the lab knife. Trim the heel of the maxillary model perpendicular to the midline. Be sure not to trim the tuberosity and the hamular notch. Place the heel of the maxillary model on the platform. Trim the base until it's parallel to the occlusal plane. As you trim, be sure the base and the occlusal surface are parallel by placing the teeth on a horizontal surface. Continue to trim the base until you have 1/3 teeth portion and 2/3 base portion. Trim the size of the maxillary model at about 70 degrees. To have the depth of the vestibule, about 4 mm from the most protruded portion of the teeth. This line is parallel to the buccal surface of posterior teeth. Trim the anterior part of the model at 25 degrees from the midline to the canine. This line should be equal on both sides. Trim the side heels of the model and have both sides equal, about 1/2 inch. Articulate the models. Place the base of the maxillary model on the platform. Carefully trim the heel of the mandibular model even with the maxillary model. Be careful not to grind off the retromolar pad. Place the heel of the maxillary model on the platform. Carefully trim the base of the mandibular model even and parallel to the maxillary model. Continue to trim the base until you have a 1/3 teeth portion and a 2/3 base portion. With the models in occlusion, place the base of the mandibular model on the platform. Carefully trim the sides and the heels of the mandibular model, even and parallel to the maxillary model. Round off the anterior portion of the mandibular model, cuspid to cuspid, to 4 mm from the anterior teeth, or half the depth of the vestibule. This completes the trimming of the models. As a final step, you may sand the models with fine grit sandpaper for a smooth finish.